Okay, so that's a really good job. Okay, so that's a positive test.
Okay.
I like how you stabilized her and you kept in control.
Right.
You got her. Okay, let's flip over. That's the right. That's her left. Her right adduction drop test positive.
Right. Okay.
If the right adduction drop test is positive, more than likely her left adduction drop test. Let's check this side. Okay. Erica, did that go better? Real good. Okay, very good. And again, I was telling them, if you leave a leg hang, Jake, can I show you something?
Yeah, sure.
This lady could have a negative test, but if you take her back and you're hanging her, she's going to start to use her outside leg muscle to hold herself up because she doesn't know what you want to do. So I hold it and I guide her, but I can't go down because watch what happens to his hand. See how my hands? Now, if we have somebody that's neutral on this table, I'll show you what the difference is, okay? But do you understand, once I'm in charge of you, you can let go, okay? That's a bilateral positive test, okay? You want what else? Let's keep going with her real quick. Let's do do you want you to do an extension drop test? Do an extension drop test on her. Any negativity over here? Everybody's positive so far?
Test me out real quick.
Okay. 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 Nice job. And again, it's the same theory. If you let it hang, she's going to start to pull up. So I would just stay and I put my hand right here and I guide her. I would guide her down. You feel the difference? If I start hanging you, she's going to start to lift up.
Just different hand
Just
placement?
stay. Yep. Just stay in control.
Okay.
Okay. Okay. Show me.
Do we start with his hips in 90?
Yep, you get this hip in 90. If I bring him up, I hold his innominate, bring him around, and I bring him back. He looks really good, and he can drop pretty easily. If you don't stay in control of that leg and bring him back, go ahead and lay your head down. Feel the difference. Feel this. I'm in control. Do you feel the control?
Yeah.
Versus that?
Yeah.
You see what you just did? You just tightened it up. You caught it. So if you just drop it, it's going to look like a false positive test. So you want to stay in control. Otherwise, it's going to be a false positive test. You see how much easier that is to go? If I guide you, you can go down. So there's no osseous limitation on that ability to adduct, right? Did that help you at all? Did that make sense?
Was he negative there?
He is negative, but I'm just showing you on a guy like this, with your frame and your little body, you might get a false positive test because you didn't stay in control.
And I was trying to, when I did it on him, I was trying to do the approach under, holding
Yep.
under the leg,
Yep.
but then still trying to be careful.
Yeah, and now you
not
gotta
to
use your
get it
body.
off.
So, but I do everything I can to get a hold of that leg like this. So bring him closer. Okay?
Do you just go to neutral?
Yeah, if you can't get to neutral, let's say I brought you back this far
Yep.
and you started to extend your back.
Yep.
You can raise the femur up, put it on the top of that lip,
That's all.
and then stay. Do you follow me? But if you keep bringing it back, all you're doing is just stretching out the front of his hip because his pelvis is forward.
Okay. You see how I do it on here real quick?
Yep.
Just to make sure
Let's
I'm doing
watch it.
right?
Yep. I like that. I like that.
That's positive.
Okay? And it looks positive to me. It really does. And because, and again, I think you did a great job. You kept everything. That is a positive test.
Yeah.
Okay? Let's try the other side. Flip her around.
Easy.
There you go. Nice job.
Yeah.
Good job. Now, let's check her extension drop test out, okay?
Might might need to move. Oh, yeah, that's right. Yeah. All right, so you expect to see.
Again, so here, I'm gonna give you a couple things. You don't start moving her, don't let her move her. So here's what I would do.
Okay.
She's not gonna do a thing. So you're gonna lay there, because you're already helping out. That's gonna be a biased test. So I got her up there, I'm just putting the pelvis in a position where her sacral position is laying on that mat.
Yeah.
Okay? Now I got you, I got control. I'm gonna start with this leg coming down. This hand is gonna secure her. If I need another person to help me, I'll get another person to help me.
Yeah.
Then I'm gonna take this leg and I'm gonna stay in control. I got you, do you feel that? I still have you, I still have you, I still have you. I have you each way. I still have you, 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 I have you, and that's a positive test.
Yeah, she's just kind of hanging out there.
But that's what we should see.
Yeah.
Now if I start letting up on this leg, I still have you, I've got you, and I don't stay on this leg, watch how this becomes a false negative test. That's a that's a positive test. But this could be a negative test, which is false if I let go.
So closer, rotate.
You follow me? So I just let that go. Now your lordosis is back. Do you follow me, guys? So you got to maintain, and remember, we got about, you need about 20 degrees. So I definitely want to keep her back.
Yeah.
Does that make sense? Do the same thing on the other side. So I'm totally in control. If I let you take over, you're going to do something to offset his speed, his lack of control and stability over you, and you're going to start to take over that test. And even if you don't do PRI or not, anytime the patient takes over helping you do the test, it's not going to be it's not going to be a correct test.
Exactly.
So. There he goes, and again, it wasn't easy to get on that table. It's a 2-joint muscle, so he did a great job. Again, I wouldn't hang it. Don't hang it. I'm being very particular with it. This is fine, but he started hanging it. Do you follow me? So if he wants to put his hand up here, he could. But see, I still have control. I'm not going to let go. Am I letting go? Still have you? Do I 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 still have you? That's it.
Yeah.
But the minute I let go, you're going to do something. Do you follow me? You're going to start to pull or something, okay?
Yeah.
What was the other test he was going to make you guys do? Straight leg raise?
I think we're doing all of them, yeah.
Okay, go ahead. Let's see. What should her straight leg raise be if that pelvis is forward on both sides?
It should be both limited.
Let's see if that's true.
Is that right?
That's correct.
So
Yep.
So it's less than 75.
Hopefully
Less than
it's less than 90.
Less than 90.
Good job.
What
She's
we
laying there.
expect to see.
Hopefully if she's intact, it should not go to 90 or above.
So she's
Perfect.
yeah. Back on this side.
Yep.
Yeah,
That's-
you're coming up here
Yep.
too.
So that's all positive stuff. That's
You're
all
actually
good
more
stuff.
lifted on the right than the left.
And that could be really soft tissue what?
Could just be soft.
Just soft tissue tightness.
Yeah.
You won't know until you get her neutral.
Yeah.
That makes sense, you
Then
guys?
you figure that out from there.
Yep. Makes sense?
Thank you.
You guys have any other questions over here? Okay, I'm gonna watch you. I like what you're doing. Okay, now you don't have to go. Since you're not doing an you don't have to go any further than that.
Okay.
So when that's lined up with that and that,
Okay.
you're done. Going more is not. Now at this position, let's see if you can lower him down, but stay in touch with him. Stay in control. There you go. Keep going. Awesome. Okay. So his right side is negative
Right.
because it can add up. Was he negative or positive?
do the left.
Okay. Did a good job. Come on over. There you go. Flip around. Did a great job. I like how close you got him. He can adduct. And I bring him back a little bit
Even
more.
more?
And I keep him from rotating. I put him right there with your forearm, but he can adduct.
Right.
If they can't adduct, you'll know right away. That bone is, boom, it's not moving. You can add that, okay? What should his straight leg raise be right now?
His left should be a little bit less than the right.
Well, if he's neutral, it should be close to 90 degrees, shouldn't it? Let's see what he's got. See what he's got. In other words, pelvis is neutral. So let's see what he's got. We're actually going to check hamstring length as it's related to neutrality. So his hamstrings shouldn't really be too short. Do you follow me? Let's see if that's true. That looks really good. So he's got about 80, 85, 90. So he's not limited. When would it be limited? When would you see limited? That's right. When that pelvis is forward, it would be limited. Does that make sense? For trunk rotation?
Yes, I got some funky deviations here.
Okay.
From what I understand.
She looks like a funky gal. Okay.
So
what are you gonna try? I mean that
So I'm
positive.
testing the left. So her trunk's going to right, her feet are coming to the left.
Okay.
So this, I know there's a qualitative aspect in it. Like she could, for the most part, keep on going on the left.
Yep. She's going a lot, so she's doing really well. Tell me when you think you're there.
Yeah, this is probably about in range here.
Okay, so let's give her 13.
13? Sure.
13? Done. That was right trunk rotation.
Yes.
Okay.
So now doing left trunk rotation. So about there.
Yep. So what do you got over here? Definitely less than 13.
Yeah.
Well, here's
12.
okay. 12.
12.
But we know it's less because you can tell you're going much further over this way in your mind, or are you in your mind?
Yeah.
Let's just say they're even. If you don't know, do they feel even?
Yeah, kind of. I mean, yeah, they do. They
Okay,
really
let's
do.
just call even. Okay, go ahead. Devin, they're even. Okay? On a person, did you do extension drop test?
No, I just did this test before.
That's all you've done so far?
Yeah, because I was in another group and I came and I tried
Gotcha.
this one.
Let's scoot her over a little bit,
Yep.
okay? Scoot over a little bit.
Actually,
What's your
continue.
first name?
Ashley.
Ashley. If I'm standing on my right leg a lot and I have to turn my body to the left to compensate for that a lot, I am going to achieve a lot of left trunk rotation, which means my legs are going to go to which direction?
The left side.
To which direction?
The left, or the right side.
That's right. So I'm going to expect those legs to go to the right side a lot. She has a little more right leg rotation, which is a little more left trunk rotation, which makes her a human. But I don't know if she's limited on anything because you got a lot of rotation. So let's check, did that make sense?
Yeah.
When we do this test, we normally see in a left AIC pattern limitation in right trunk rotation.
Correct.
Which means if it's limited in right trunk rotation, the legs don't go over to which direction?
The left.
And we saw a little bit of that. She couldn't sense it.
Yes.
So I don't think it's a problem. Let's see if that's true. Let's check her adduction drop test on both sides.
Yep.
Okay?
So I have, go on your left side. This is her left.
Yep.
So far feels pretty good, but I can't go anymore.
Okay. Can I check?
Yep, perfect.
Can I check? Got her secure. Got you secure. And that's a positive test. Okay, flip around.
So we both got a positive test.
We both got a positive test. Okay?
I feel about better now.
Okay? You did a great job.
Thanks.
We both got a what? I know that's a positive test. So with that amount of rotation coming from her body, and both tests are positive, on both sides, she has that amount of much trunk rotation. This lady's laxity and restriction is, the restriction's minimal, the laxity is high in her lumbar region.
So then-
She has lots of rotation.
So we're seeing the iliolumbar ligament rotation.
Really loose.
And that was
really loose on
validated
this
by
lady.
her adduction drop test. So the trunk rotation didn't necessarily tell us that.
No, but you would hope that since she had so much trunk rotation, that she could adduct both of her legs. So since she
I see.
cannot adduct both of her legs, we've got some issues above, which is a whole nother course. But we've got a lot of rotation coming out of her lower spine, an quadratus lumboris region and iliolumbar region, where you would hope to see it a little snugger for what she just gave us there. I wonder if her extension drop test is negative, because I saw you bring her all the way back. Remember that?
Yep, on that right side.
If her extension drop test is negative on both sides, she's popping out of those hip joints, she's moving her hip around, and her pelvis is always in a state of what? Forward inclination. Let's see if that's true.
So then
Let's check that out.
would be ligamentous laxity.
Bingo. So this woman has got a ligamentous laxity body.
Yeah.
Okay?
And I know this is outside of the PRI
No, you're doing great.
realm, but essentially, if she did have ligamentous laxity, she should have almost total body, almost congenital laxity. So I would
Possibly,
almost be able to
possibly.
see laxity here, which I could see it.
Right. It's a possibility.
In essence, right?
Yep. So check her extension drop test out. And we already know this is going to be negative because you brought her all the way back into. And what I would do on this one is just stay in charge.
So when you,
I put my hand right here and lower that down. Take charge of it. That's a negative test.
yeah.
Do you follow me?
Yeah.
So she's just popping right out of
Yeah.
it. Okay. Stay in charge. So stay in charge.
Go right here.
Right there?
Yep. And let's go here.
Stay in charge, because she'll give you a false deal. That is a negative test. That
And
too,
do this external rotation.
and you don't
here.
want it to externally rotate. You want to keep it neutral, and that should never go that far down.
I see.
That had to pop forward because that pelvis is already what?
So
Forward. See how she wants to
already
rotate?
lax, though.
See how she wants to
Yeah.
rotate out? Her external rotators are rotating her out because she can't stay in an acetabulum that wants her oriented in.
So would you drop this like,
Straight down, because that's how we were taught in school to do it.
and then when you let go, what
It
happens?
externally rotates,
Yeah.
and her femur
I see.
pops out of the acetabulum. Do you follow me?
Yeah.
And she's rolling out of it because she's learned how to what? Rotate well with her trunk, rotate out. Was that helpful?
No.
You guys did a great job. Nice
Thanks.
work.
Thank
Good
you.
work. Okay.
Appreciate that.
So go ahead. You keep going. I'm gonna listen. I'm gonna listen to you. Okay. Okay.
Place the ball between your knees. Inhale through your nose and exhale through your mouth, performing a pelvic tilt so your tailbone is raised slightly off the mat. Keep your back flat on the mat.
Right. So you and Mike went over this. You don't want a lot of ab work here. Okay. Jelly belly. So go ahead. You take a deep breath in, blow out the air. He went up there, and then what are we going to do next? If he's got that, if he's got the ability to lift up. Mark, do you feel that? Okay. Let's go back down, Mark. Just go back down. Now, Mark, do you feel your feet pushing down when you do that?
Yeah.
So there you go. Good job. There you go. So he's going to pull himself up with those hamstrings. Keep going. Come on in, Tricia. Okay, go on up a little higher. Okay, so you feel both hamstrings? Okay, what's the next thing we're going to do? You can hang loose, okay? Hang loose, okay?
As you maintain down now. As you maintain the hip lift, shift your left hip down and your right hip up so that your right knee is slightly above your left.
And what's that called? What position are we going to put him in? Left, go ahead. Mark, what is it? Left AFIR. So we're going to move his pelvis back, and when that pelvis moves back, as he goes back, that femur is going to roll in. So it's the acetabulum is moving into internal rotation on that femur by bringing this knee up in the air. That would be considered AF ER, and this would be considered AF. Show me right AFIR.
Right AF.
What would be right AFIR?
Well, that'd be the opposite one.
There you go. That's right AFIR.
Which I don't want to do.
No, so that would be right AFIR. Show me bilateral AFIR.
I guess if I wanted to shift both, I mean, I just got to pull down with both, and I'm there, right? I mean,
Well, you'd have to take this foot over here, and you'd have to take that foot over there. You'd have to squeeze the ball,
would that be
and
more
that
of a PEC thing?
that'd be more of a PEC type thing. Now you're in bilateral AFIR.
Classified, and I've never been taught that.
Yeah.
I've seen it.
Yeah, so that would be
At the
more like,
baseball
yep, that's,
somewhere.
yep. So I'm just kind of taxing you a little bit.
So I should
Okay,
actually be doing this one. Or so should
so let's go back and let's get him into, let's get him into left AFIR. Let's get him into left AFIR.
Are you getting good left hamstring with that?
Good question. Come on over
Yeah,
here.
got it.
Come on over here. What'd you ask him?
If he was getting a good hamstring left hamstring firing with.
Right, because for him to really have AFI on that side, he'd have to have his hamstring there. Do you feel that? So what did you have to do to get that to fire?
I want AFIR on the left.
But what did you have to? Very good. You had to do what?
I pulled down.
You had to find a muscle to pull that leg down. What muscle was that?
Hamstring.
Bicep femoris. Okay. Okay. So now we got him in. We got a little bit more AFIR going. Get the right knee up in the air. Shift the right knee up a little more. A little more. A little more. Good. Okay. Do you feel the left inner thigh?
A little bit.
Okay. What if he says, no, I don't? What would you have him do at this point?
Maybe squeeze the ball.
With which leg?
Left.
Right, because if he squeezes with the
A little
right,
bit more, yeah.
now you got a little more
I've
AFIR.
been
Do you
taught
feel
that.
it?
I've been doing that.
So if he didn't have his hamstring engaging, you could say, hey, why don't we get a little adductor? Which adductor do you think we're kicking in?
It's the IC adductor.
Very good. Ischial-condylar adductor's kicking in. All right.
How about this hip? I mean, to keep more of that kind of zone over there.
Yeah,
I've
so-
always been yelled at like for that, like, you know, hey, get that left hip up, Mark.
Yeah, so what you want to do is just stay neutral and just shift. You tend to drop this hip?
It doesn't stay like that as well. So I have to actually focus on that.
Okay, well, you wouldn't have to worry about that if you push into the wall, pull down. You shouldn't have to worry about
I got
that.
it.
Got it?
So if I do it
So it's
well
automatic,
enough
it's getting your-
and I'm pinching in, it should hike it up right.
That's
right
correct.
side.
That's correct.
I got it.
Another, okay,
I don't know
so
how much of a, like on this now, I'm supposed to feel some tension here. Not like I'm supposed to be all loosey-goosey. Like my first initial one was kind of like, okay, I posteriorly tilt. That's where I think it gets a little cloudy sometimes as far as
the
my
more you can
abs
relax the belly, the better off we
on
are.
all of these.
All
I know
of them.
one of the
All of
therapists that I work with who does this, people have a hard time with the tilt, she puts a small towel roll.
I'm good with that.
Under the.
I'm good with
not a
that.
problem with
Yeah.
tilt.
But you know, he knows what's going on.
Yeah.
A lot of patients. Okay, so we got him up in the air, Tetsuko. Okay, he's up in the air. He got his right knee higher than the left. Okay, nice. And you got a guy that's really helping you out here. Okay, now he got his left inner thigh. No abs or some abs?
I'm relaxing.
You're doing a great job,
Left a
Mark.
little bit here. I'm
Yeah, so he's
relaxing.
relaxing.
Rectus.
That's what you want. No rectus, no hip flexors. Hip flexors are off. Rectus is off. Back should be off. Hamstrings are on. Glute might be on a little bit. Inner thighs on. Okay. Shouldn't be pushing in the floor. Heels on the floor. Heels down in the heel cup. Things are going good. What's next? What are we gonna do here?
He can lift his foot off.
Well, what are we gonna make sure he's doing though?
Breathing.
Ah, is he breathing? Okay, let's see him breathe. Let's watch him breathe. Okay, in this position, which chest wall is probably going to open up?
Hopefully the right.
The right side, hopefully. So we'd say, take a breath of air in. When you take a breath of air in, try really hard to take that breath of air in without pulling with the neck. So every time he breathes in, he should be pushing back down with his left foot, because if he is, he's going to get better air in on the right side. Nice job. So if he's saying, you know, I'm kind of wiggling around a little bit, well, instead of getting his abs and get him stable, why don't we really make sure he understands this leg, this hamstring, as he's breathing in. When he blows out, what do we want to think about doing?
Bringing down this side.
Well, how would we bring that side? Because that's a different course. How would we bring this side down without going here? What would you do with that leg as he blows out? You got her, buddy. If he takes that right knee in the air as he externally rotates, you know he's got his left obliques. Does that make sense? So he's blowing with his left obliques. He's breathing with his diaphragm, and everything's cool. Let's check it out.
I've
Take
got an inhale here. Okay, so if
So you're going to inhale right here. Push down, inhale. Blow out, exhale.
I feel my adductor more to do that.
Bingo. Breathe in, inhale. Push. Blow out, exhale. Got it?
Never done that before.
Okay. Now we got a technique we got to do. What's the remainder of this technique? What are we going to do now? It says 90-90 hip lift with hip shift, and it says slowly take your bent right leg on and off the wall.
Which
Okay.
I've done
So
it in a
he's just
short
doing
manner, and I've
this?
done it
Or
like
was it
this,
the
and I've
straight
done it
Tap
like
it.
this.
I wouldn't put. You could do either one. You could do all three. You can do them all. But let's start off because it's a newbie. Let's just take the leg on and off the wall.
this way.
Yep. Okay. Let's see how he does. Okay.
Just getting in position.
Hold. Get your breathing. That's the technique right there. That's a 90-90 hip lift. Okay, but now we're going to do a little bit work with that right leg. Okay?
So now,
Get your breathing down.
Yeah. I'll do one with that pull.
Okay. Nice. And then right there, start your breathing.
On and off, you want?
Yep, just tap it. Just tap it.
Yeah, I've done this.
Is your back
And your
kicking
breathing
in?
I think so.
Is your breathing good? And is he jelly belly?
It's hard for
Pretty
me.
much, but you're doing it.
harder for
Okay,
me
so
to-
it's harder for you to do it. Let's see if we can do this, okay? Put your right foot back on the wall, okay? Let's go ahead and did a good job. So his belly's kicking in. It's going to have to kick a little bit in when that right foot comes off
Yeah,
the
that's
wall.
always my question.
It's
Like,
going to have
gosh,
to kick
it's
a little
like-
in.
Okay,
But
it
what
did.
could you do to prevent that from kicking in more? Find your floor. Find the ground. Where's your floor?
Find the ground with my left
Right.
foot.
So
I'm saying
let's
more.
really think about not pushing, but pulling.
Sure, yeah.
And let's try it again.
So I get
Now
set.
put your hand under his heel. Now, can I step in there? I'm just going to step in there for you now, okay? And I'm going to really help her. Mark, do you feel us pushing up on you a little bit?
Yeah.
Push down on her hand. Got it? Now take your right foot off the wall. Did that go better for you?
Is that better?
Yeah, I feel like
So, if he's using his abs, if he's using his abs or his neck to breathe with, and he can't shut those babies down when he takes that foot off the wall, which muscle's still lagging? Which muscle does he still lag with?
you're saying hamstring.
Very good.
I mean, yeah, no
Let's
doubt.
see if the human body is really different on the other side. Okay? Let's reverse the whole thing and see if we have to do any of this. You understand what I'm showing you? In other words, if this is a piece of cake for him on the other side and you can breathe, then we know we got an asymmetrical body, right? So we had to put a lot of work to find that hamstring, didn't we, on that left side to get you to breathe. Let's reverse it. Okay. Tatsuko, go ahead.
So,
You want me to do that on the other side now?
yep. So you're gonna focus on.
I'm gonna screw you
Why are we
up.
doing this?
To see if it's easier for you to breathe.
Okay.
Still gotta tilt.
So go ahead and lift your. Good.
Oh,
Gotta push down with both legs right now.
feet.
Right.
Yep.
Now you're gonna push for your left leg.
Yep.
Next left knee.
Yep.
Right.
Yep.
Keep breathing.
So the pull down with the breath in with the pull down.
Yeah,
here.
just get that. Should find that adductor pretty easily.
You feel that?
Feel the hamstring? Did you have to work hard to do all that? Okay. You don't have to say too much. Okay, right? Keep doing it. Let's go back up in the air. Do it again.
It's tiring, isn't it?
Drop your left or right.
I'll go back to left.
Okay.
I mean, I got it.
Okay, but I want to show you the right here in a minute.
Okay, I'll do
Go-
the
Okay,
right.
now, right here, got it? It's a piece of cake, got it? Take your left foot on off the wall. Is that easier to breathe?
Yeah, I feel like I've got more of a whoop, like
So
it's grabbing better.
that tells you that when he's on his right leg, the guy can breathe with his diaphragm a lot better than he can on the left. Because this diaphragm is huge
and
compared
I
to that guy.
smashed a ball from my back into that foot right here.
Oh, that didn't help.
Sunday.
That didn't help. That didn't
That was
help.
about 85 miles an hour that went into my foot, probably about 105. And I'll tell you what, that next morning, man, and that's why I think my symptoms, because it's forced me all week. I've
Just
been
on
a
the
little
right
more
side.
right-legged. Even though I
Yeah.
did a sprint workout yesterday.
Yeah.
And when he tested me, I'm like,
Yeah.
I was like, well,
Well, get back to your exercise.
I'm getting back to my work. I mean, but I do my stuff every day. But I'm
Sounds
learning just
like
some
it.
finer tuning points in
A
this.
little
And
bit.
again, I just want them to, for guys like me, I really want them to shout those things loud.
Right.
Sometimes I just feel like it's not
Understood.
like my coach would be. Listen, just like that.
Yeah.
This is how it's got to go if you
Yeah.
want to get results. And I just don't. Sometimes I feel like it's a little soft, like the really important points. Like let's make those like really like.
Well, and that's why I like this technique, Mark, a lot,
Yeah.
because this technique, it doesn't have to be work. It's not like a strength conditioning technique.
Right.
Sense it, feel the floor, put your mind, put your biocentrism in that wall.
I love that.
Because the central tendon of your left side is lost. So the more you pivot around that foot, and the more you can breathe around that foot, and the more that hamstring's engaged for that stability you need to take your right foot off the wall, which is really a transverse direction. Let's think about the three planes. The first thing you did was put your foot on the wall. That's sagittalism. That's repositioning. The second you did some frontal plane work. How did you do the frontal plane work? How did you do that? You shifted, and when you shifted the knee in the air, the entire center of your mass went over to which side? Went over to left. That is a center of mass shift to the left. People don't really understand all the things that are going into this 90-90. They think it's a 90-90 hip lift to find a hamstring, but it's more than that. And this adductor's pulling this pube all the way over to the left side. Let that happen. Let your adductor pull you over there. Now once that...
Thoracic abduction, yes.
Now you got your thoracic abduction you need. So if you got adduction there, you got abduction here. Now you don't have to worry about your abs. And your abs can help you rotate when needed for breathing, for their rib rotators. And once you get that, what's the last plane left? Rotation, transverse. The minute you take that foot off the wall, you got to kick in rotators of the AF joint on that ankle to allow you to rotate every time you move that foot up and off that wall. That's how much is going on that we don't talk about. It looks like a sagittal activity, but if you break it down and you get the respiration, it's all three planes. That makes sense to you? Would you show her how to do an adductor pullback?
Sure.
Okay, on the right side. Okay, tell her what to do, and let's do an adductor pullback.
Where's a pillow? Let's give her a pillow. Let's make this girl comfortable.
You guys have any questions? You doing okay? All got it done? Are we doing adductor pullbacks too? You guys doing adductor pullback?
Is that on the side?
Yeah.
Yeah.
Okay.
I had a question about that one.
Okay. Let me see how he does. I'll come and get your question.
Medial shoulder of that bottom arm. I mean, sometimes that's why I like the pillow because I think I can get
That's
people
fine.
to be there a little
Yeah,
better
that's
than kind of
fine.
being, like,
Yep.
you know, on the
Okay.
backside.
Yep.
So anyways,
Okay. So Mark, I'm gonna stop you a minute.
90.
Okay. So the reason I picked on her a little bit. First of all, is this a 90-90 hip lift?
So a 90-90 hip lift.
Answer
no,
would be
because
yes.
that's the other, what's side lying? 90.
It's a 90-90 hip lift.
Okay, yeah, I'm with you.
This
The
is not any
positioning is
different than
still
what we
90.
just did.
Yeah. it's side
If she
lying.
does an adductor pullback, is that a 90-90 hip lift with the right foot going on off the wall?
Yeah.
It's the same thing. So we'll look at your patient. How are we going to get her in a neutral position, a 90-90 hip lift? What do we got to do with this young lady? What do we got to do to make this more comfortable for her? Well, we got to put something underneath her torso because she's sagging. So we're going to put something right here. Let's find something. Let's put something under here. Find anything.
Find that more with women because
A little bit, but look at her. She's way sagging. So her hips are way sagging. Look at this. So we got to put a little bit. We should anyway. A little bit of material right here. Okay. Hey RJ, do you have a towel? A towel? That's a little bit too
Be
much.
really flat if we're going to use it.
He's going to get something. He'll get something. But you see what I'm doing? I'm basically taking this position and putting her in that position on this side. Does that make sense? So it's coming. Let's keep
Does it
going.
look different for a guy to be down there? Than
Yeah,
for me?
if you and you wouldn't need this towel.
Okay.
That's
thank
why I'm
you.
picking on her.
I'm like,
RJ, I'll
it's
take
all
it.
about the hips and the Q angle.
Yeah, it's the same. It's the same deal. So I'm going to take a little towel, just a little towel. Your baseball players don't need this. But do you see how they gave you a little security on that hip? Keep going,
now,
Mark.
what I've been doing, and again, I'm just going to go with what I've been doing.
Yeah, no problem.
I try to get people to get in tune with being a little bit more
Round.
rounded. So I mean, I actually take my hands there and I just say,
I
let's
love
go here
it.
and exhale a little bit
Mark,
with
you-
me
I
when you
love
do
it.
that, right? So that we can just feel that fetal position, as
Yep,
I call it.
I love it.
So now we're set there. Now we're supposed to have something here and here when we do this drill.
Okay,
so
go
I've
ahead.
got that. So we've got our.
And well, if it's not enough, keep going. Keep
So
going.
I just use this one here, right?
Right on top, Mark's riding.
Yep. So, oh, I'm sorry, bro. Now, can we just lift
Two
this?
marks. That's why he felt comfortable.
Can I just lift
Yeah.
that here? Typically,
Sure.
I have it more
No
like that
problem.
when there's nothing.
You're doing a great
Okay.
job.
All right.
We'll
So
just
we're gonna
assume you have
maintain
something
that.
right here.
Now, a
He's
lot of
lining
times
you up.
also what I have to do is I have to get my people to be in tune with saying, I want this to live a little closer to your rib cage.
And that's
okay, your
different than what
pelvis.
we talked about earlier. He's doing a good job.
Okay,
He's saying, you
so
know,
that's number
if
one.
I let her sag, that's artificial. But if I just say, what's the best way to get this pelvis pulled back in that position? What's the best way to do
cue or
it?
the
Yeah, what
best-
would be the best cue?
I say it's hiking. I say bring your pelvis towards your rib slightly, but that's what I
Why don't we
say.
get a little right AFER going?
Okay.
What's the best thing? What does it say? Somewhere on the adduction, somewhere on this sideline work, on the top of page 3, What does it say to do? Push your right foot into the wall. Do you see that? If I push your right foot into the wall, push your right foot in the wall, already you got a little AFER on which side? Which ER on the right side. So you know you're going to get AFIR on the left side. So you just repositioned your pelvis.
And I don't know in the order. I always do this. I go from there to here, and I say I want that.
No
firm,
problem.
I want that firm,
No
if there's an
problem.
order, I'm cool.
I only brought that up because of what you told me.
Okay.
Okay, so keep going.
Yep. So I got that. So then I go down and I want both of these heels firmly in there, in with the toes.
Right.
I want those on there. And then what we're going to do is what we call a scissor slide, or we're going to make this leg shorter. And we're going to try to think of making that shorter by an inch, but don't lose that rounded
Right.
position or that. And you can even think of reaching with this bottom leg just a little bit forward as well as
I
going
like
right
it.
there.
I like it a
That's
lot.
your inhalation, right? So we're going to inhale during that, and then we're going to exhale and squeeze down. Maybe like 30% of max effort and to down. So give me get some air out, right? Now on your next subsequent inhale, right, we're going to try to move maybe like 1/8 of an inch because it's not going to go very far, and then again we're going to work on our exhale. So again, remember we got two things going on here. Keep both heels pressing into the wall, right? So I call that the yin and I call that the yang. Got that? So we're going to do that 4 cycles is what I do of the yin and yang, inhale, exhale. And then after that, we're going to get after this to lift that from the wall. Keep that position. Don't let anything go. And then we're going to lift it, what he did with you at the top. So now, the question for me is, we have that. In our manual, there's also, like, I can internally rotate.
This table I want back wherever they went.
I
I
could
want
do-
this table back wherever they went.
So I could.
The people at this table.
Yep.
Okay.
So I could
For good?
do.
Okay. Okay.
I could do a little bit more FAR here, perhaps. You tell me, because
No, that-
he had her neutral and just said, you're fine right there for gluten and meat, but I've learned it where I go more for me personally.
Yeah. No, you're doing great. So first of all, I'm listening to you.
Yep.
You got the AFIR part.
Yep.
You got her to squeeze part.
Yep.
When you have her squeeze, she's still in AFIR.
Right.
The minute you take this femur and you internally rotate, you're now in, and you're doing FAIR activity
Right.
in an AFIR position. Does that make sense?
Yeah.
But first you got to make sure she can get AFIR, and you did well with that by inhaling and exhaling and inhaling and exhaling. Okay? And then once you have that, he's going to have you lift this up, and when you breathe in, you'll IR a little more. Okay? You don't have to, I got you. And you'll exhale, you'll squeeze, you'll inhale, go a little more. When you exhale, what foot could be pushing down in that wall? There. And then relax. So she's getting that posterior hip capsules to stretch out, and she's doing it with a corkscrew type of activity, and you did a great job.
Thank you. So you're
did
okay
a great
with
job.
adding that if
Totally,
they're
totally.
at that level?
It's a technique following this technique.
Okay, cool.
Okay.
She's already in the perfect position.
Yeah, she really
Yeah,
is. She
yeah.
really is. She
Yeah.
really is.
But,
Okay.
Yeah, a lot of people have a very difficult time when they go into their second, third, fourth subsequent scissor slides. You know, they're trying to go further, and I said, "I want to go like this."
Yeah,
much,
you don't have to go
typically,"
far, yeah.
Right, and then they just boom, they pop into
Mark,
some
what I
extension.
liked about what you did in this for this table and demonstration is you emphasized the need to inhale when you come back. And that's the biggest part of this technique. So by pushing this foot in the wall and by inhaling when you go back, you're allowing your pelvis to open up on the left side, another course, your mediastinum to open here, and your mediastinum to open here by doing just what he said when you pull back. What muscle is now acting as an inhaler? And I'm going to clue you, it's not the hamstring. What muscle is helping your diaphragm to pull in air on the right side and the left posterior mediastinum?
I'd say it's got to be left oblique wall.
Close? That's an exhaler. What's pulling in the air in? The ischiocondylar adductor.
Okay.
So the medial hamstring group and the ischiocondylar adductor, that's what you asked her to do.
Right.
You asked her to pull this knee
Yeah.
back. What pulled that knee back? Was it a hamstring?
Besides the
really.
IC adductor, you're
It
saying?
was the IC adductor.
Oh, okay. I
It
thought
was
that
the
was a
IC
given. I thought you were
adductor.
asking for something on top
Well,
of that.
no,
but I'm
no,
like,
I'm just kind of helping out.
Yeah,
You
yeah,
did
yeah.
it. You did a perfect job.
Yeah, I got it.
The
IC
minute
adductor
she's
for
breathing
sure.
back, you use the IC adductor. So
sure.
the answer to my question is, what's the best ally for the left diaphragm leaflet?
Okay, the left IC
IC
adductor.
adductor.
Okay, okay. Yeah, I'm with you.
So is that a breathing technique? Sure is. That's a breathing technique in a 90-90 position on your side to help the posterior median sternum expand on this side, the pelvis to open up in another course, and to get you to shift something over to this direction with a diaphragm doing the majority of the work by where it's directing pressure intra-abdominally and intrathoracically. So you're moving a body with a diaphragm and an adductor and on a polyarticular chain that's being carried out by the way she's controlling her breathing pattern.
And it was huge for me when I was supine doing the.
Yeah, it's the same
when
pattern.
I was inhaling with my pull,
Yep.
and then I was exhaling with that reach of that knee,
Right.
which you emphasize. And
Right.
again, I've not done it in that particular manner. But that
One
helps.
more question from the two of you.
To get IC adductor.
What would be the advantages of this 90-90 versus the upright 90-90? Which one? When would you use what? When would be a good? What would be the reason to pick the last one versus this one? What would be the reasoning behind either one? Give me
From a
maybe.
hierarchy, you get. I mean, I thought hamstring has to be first on
Totally,
board to
but
help
let's say they have their hamstring,
Okay.
but they're still struggling with breathing
Oh,
because you can't breathe well when you're laying on your back. Here you're not breathing on your back.
okay.
Let's say they can't even get a posterior pelvic tilt. Let's say they don't even know how to do it. They got their hamstring, their back is on, they can't do it. Why continue that? Get them in the position. I love what you did. Want to round their back out? I'm going to do the same thing in a sideline position.
So it's easier
For them,
to
yep,
maintain
yep.
or to get in.
You follow me?
position.
So they're the same techniques, but if you start clinically thinking about it, this is a better position to get in for those individuals who really are having a tough time shutting off the need for them to pull in air because they can't shut off their lats and their back muscles and their neck. Just kind of drilling you a little bit, okay? You guys did a great job. Thanks a lot. You guys did a really good job.